Okay, okay. Okay, okay. Okay. So to continue the concepts of disease and health, last time we had talked about how what is disease, what is health, and we went on to consider as to what we would do as far as prevention is concerned. So I'll just run through these are all these things which we have done already: determinants of health, concepts of health, social concepts, epidemiological triad. We went through agent, host, and environmental factors. We considered the concepts of causation of disease. We talked about the germ theory, epidemiological triad, multifactorial causation of disease, and then we talked about the epidemiological web of causation of disease. And that is one of the most important web of causation of disease. Then we went further into the iceberg phenomenon of disease, where we had the invisible cases, more invisible cases than the cases which clinical cases and death. And then we considered the natural history of disease, where we had the pre-pathogenesis and the pathogenesis phase, in which we said that in the pre-pathogenesis phase we have the various ways in which we can prevent. We'll talk about that. We also mentioned about the carrier state and the risk factors. Very important, the risk factors which are there, modifiable and non-modifiable. I'm saying important from the point of view of your exams as well as in life is concerned. Risk approach to disease. We talked about disease control, elimination, and eradication. Three important words which are asked in the Viva very often. And we considered about the levels of prevention with primordial prevention. We talked about how primordial prevention is very, very important, and how we can then do primordial prevention if the risk factors are not permitted to develop in society. So let's consider primordial prevention in detail. I think I did cover it last time, but just let me run through it. Basically, primordial prevention is for chronic diseases and prevention of the emergence or development of risk factors which is there. Well, mainly it is done by individual or mass education or environmental modification. It's the prevention in the purest form if you look at it. And if you look at the factors that if you do not have, let me just give you an example. If there is no tobacco, where is the question of smoking? So that's a primordial prevention. You are preventing the risk factor to come into the society. Okay. If you do not have burgers, who's going to eat burgers? Before McDonald's and etc. came here, we never had burgers here in India. Okay. If a person right from childhood is inculcated with the idea that exercise is a part of his living, so he will consider that exercise is good and will continue to do this. That is primordial prevention. Okay. Eating habits. The higher the socioeconomic status, you have got more people eating foods which are junk foods, while we have the poor who are unable to meet their daily nutritional requirements. So high fat intake, junk food, these are all low fiber. These are all from the middle class and the higher class, which get obesity, coronary artery disease, and hypertension. Smoking and drinking can be prevented. Unhealthy lifestyles, you can basically change the norms of society, where drinking is considered to be normal. If that is the norm is changed, we will be able to then bring about a revolution as far as decreasing the amount of liquor being consumed or smoking. Physical activity can start off in school itself. Girl child health is very, very important, because once the nutrition of a girl child is looked after, the mother will automatically become well nutritioned, and there'll be less low weight babies. So then let's go on to health primary prevention, where we have it divided in two portions: health promotion and specific protection. And in this also we have two types of strategies which you can employ. One is population strategy and high risk strategy. Let me now try to emphasize on you a very, very important thing. Any question which you get and you ask prevention, it is the best way to write that question is to break it up into primordial prevention, primary prevention, secondary prevention, tertiary prevention. Primary prevention to health promotion, specific protection, secondary prevention into early diagnosis and treatment, and then after that into rehabilitation. Okay, all these things which are there, if you break it up and you further break it up into population strategy and high risk strategy, you've already written about 1 page of all these things. So you write a little bit in between, you will get your marks. And this is one of the important things which you should learn as to how to write an exam. Okay. The population strategy and approach directed at the whole population, irrespective of individuals' risk levels. And so, if you like, for example, see a small reduction in average blood pressure or serum cholesterol for population would decrease the number of cardiovascular diseases tremendously. So just a little bit has to be done, a little this thing on a population scale, and you'll get wonderful results. High risk is those individuals who are at risk. I've got a person who's got diabetes. I've got a family, mother and father who have diabetes. Now the daughter and the son, they are more likely to get diabetes. If they are likely to get diabetes, can I coach or educate that boy or girl that you are likely to get diabetes? Please be careful about all your lifestyle issues. Increase your decrease your carbohydrate intake. So we can use a high risk strategy. High risk, those people who are promiscuous, they're likely to get HIV. We should get them into a system by which they use condoms, or those who are for people who give regularly are or those individuals who are regularly take blood, like hemophilics, or for that matter those individuals who have who have all the now hemophilics, for example, receive blood, so they should be more careful as far as getting good blood is concerned. Okay, let's move further. I will not go into details because it will take up a lot of time. We have to finish off. This is a revision lecture. Health promotion and specific protection. Health promotion basically being health education, environmental modification, nutritional intervention, lifestyle and behavioral change. So these are health promotion issues where you have a target population for health education and give them health education so as to prevent various diseases. This can be community leaders or otherwise. Environmental modification, give them good water supply, sanitation, control insects, and give good housing. This will itself decrease a lot of diseases. Nutrition, either poor nutrition or overnutrition. Both the things have to be looked at, and can have some nutritional programs. Lifestyle and behavioral changes. These are very, very important for prevention of most of the non-communicable diseases. Specific protection, that is, either you're giving immunization or you're giving chemoprophylaxis. So, or you're protecting against occupational hazards, carcinogens, protect against air pollution, noise pollution. Those are various things which can be done. Now, if you really look at examples, hypertension. What do you do in hypertension? You have a population strategy. Basically, lifestyle. Lifestyle means nutrition, weight reduction, exercise, and behavioral change. These are the things which you will do. Nutrition: decrease your salt intake, decrease fat intake, avoid alcohol, reduce your weight, do exercise regularly, decrease the lipids, reduce stress, no smoking, yoga, etc. These are things. So this is how you will answer your question as far as prevention of hypertension is concerned. Now, in hypertension, you can have what is called the high risk strategy, where you have individuals who are prone to get hypertension. They are the ones whom you will target. It is hereditary, so you know their parents have got hypertension, so you look at children whose parents have got hypertension. Lung cancer, basically again you look at how you can prevent lung cancer with decreasing of smoking, education, national health policy. or you can have legislation and restrictive measures for stopping smoking. Various legislative measures can be put into place. You can ban tobacco growing. So it can be done. It depends on whether there is the political will to do it. National and international coordination is required for that. Okay. Again, the at-risk approach, you take the people at risk. You have now various things coming up, chromosomal link disease. You can map your chromosome. You can do your various things which is there and find out what diseases you are likely to get. Immunization, of course, against various diseases. Nutrition. Not we'll skip a few slides because otherwise we're going to go into too much of detail. Secondary prevention. Now, secondary prevention is early diagnosis and prompt treatment. Now, early diagnosis, you see, uh, what you can do is when you're doing a screening, you do before the onset of the disease, you you do some diagnosis, some tests could show that whether the person has got anything which is likely to take him to that disease. Or, for example, if you're looking at diabetes, you can do mass screening, check with your glucometer and check whether the person has got diabetes or he is into impaired glucose tolerance, and then call him for further investigation. So you can have individual and mass case finding measures, screening surveys. You can do a periodical examination or special examination in high risk groups. Secondary prevention is employed at various levels in general population, in high risk groups, and in clinical setting. All these things. Disease process is already initiated in the body, so one has to then look at early. You've done the early diagnosis, you must treat the person. Okay. So secondary prevention we will discuss it in communicable diseases and non-communicable. In communicable diseases, it's more towards detecting whether the infection has taken place, and then you can do a mass treatment. You can give individual treatment or mass treatment. That is a large number of people given. The latest mass treatment which has been given is the one which is given, the deworming which was done. Deworming day was done there, and we dewormed the whole of the country. A large number of, as far as possible, children were given deworming treatment, and that hopefully has decreased the caseload as far as worms is concerned in our country. Mass treatment also prevents new cases, and it has effectively controlled a number of diseases like yaws, scabies, trachoma, malaria, and worm infestations. Secondary prevention in case of various diseases you can look at. You can say, for example, this one is amoebiasis. If you're looking at a fresh stool sample to detect it's very difficult to as such find amoebic trophozoites which is there, but serological test you can do some this to detect this thing, and then give early treatment of metronidazole, trinidazole can be given. Asymptomatic infections or carriers, these are the biggest problems which are there, and these need to be removed. Secondary prevention in non-communicable diseases basically from lifestyle disease issues, and so we must try and prevent those with finding out the disease and then finding out whether the person is having early symptoms of the disease or early or we detect it early, and try and do treatment as early as possible. Now this thing of lead time is also a very, very important thing. Must remember, the lead time refers to the time gained in the natural history of an evolving chronic disease when diagnosis is made early. You detect hypertension at the pre-hypertension stage, or detect diabetes at the impaired glucose tolerance stage. Put a control over there, put treatment at that particular level. It will ensure that further progress of the disease and further complications due to the disease are stopped. Carcinoma cervix, you can detect in the pre-symptomatic stage, and then the ultimate prognosis becomes better. we talked about hypertension. You can detect it much earlier. So early case detection can be done and treatment can be given. Patient compliance is also another big problem which is there. If the patient does not comply with long-term treatment, then you can have problems. Secondary prevention is more expensive, less effective. You can do a primary prevention, you can prevent a lot of things. Once a person goes into has already got the disease, then becomes more expensive. So let us go into tertiary prevention. Tertiary prevention is disability limitation and rehabilitation. And in disability limitation and rehabilitation, it is a mode of intervention in a late pathogenesis stage. And basically, you must remember these three words: disease, impairment, disability, and handicap. Whenever there is disease, there will be these three: impairment, disability, and handicap. Please remember these words. These are asked often in the exam, in the vivas. So then you can answer. Impairment is any loss or abnormality or psychological or physiological or anatomical structure. It may be visible or invisible, temporary or permanent, progressive or regressive. So anything where there's a psychological or physiological anatomical structure which is lost or abnormal, then you call it an impairment. Disability is any restriction or lack to perform any activity within a range of considered which is normal. Any restriction of movement because of that anatomical deformity, he is not unable to walk. That becomes a disability. Handicap is a disadvantage of an individual resulting from disability. That is, for example, because he got an amputation, which is a impairment. Amputation is the impairment. He is unable to walk is a disability, and he is unable to work. That's the handicap. Okay. Okay. So these are various examples which are psychological disability. But we discussed it in class earlier, so we'll not go into details. So prevention is by pre-exposure prophylaxis, post-exposure prophylaxis. That is there. Malnutrition also you have got. Here's this thing. I'll just run through this. Rehabilitation. In rehabilitation, combined and coordinated use of medical, social, educational, and vocational. Earlier it was only medication, medical. Now it is social, educational, and vocational rehabilitation. What we are looking at. Training and retraining the individual to the highest possible level of functional ability. That's what rehabilitation is. So rehabilitation, you can see the medical, there's a functional element. Vocational is restoration of early childhood and livelihood. Social is family or social relationships. And psychological is personal dignity and confidence. This you can do by establishing schools for the primary reconstructive surgery, muscle re-education, modification of lifestyle, and change of profession. A suitable one should be taken. We talked about impairment, disability, and handicap. These are just the definitions which you can look up in your book. Now, we also move today into another chapter, which is health indicators. Now, health indicators are basically, you must remember, this comes very commonly in the exam. So, how healthy is a hostel or a community or a locality or neighborhood? How do you judge it? Can you say whether your hostel is healthy? Can you say whether Medchal is healthy? So, how do you do it? You have to have some sort of indicator for that. And these indicators are required not only to measure the health status, but also to compare with others, assess health needs, allocate resources, monitor, and evaluate. So the various indicators which we have are morbidity indicators and mortality indicators, which are the most commonest used indicators. Others are the disability rates, nutritional status indicators, healthcare delivery indicators, utilization rates, indicators of social, mental health, environmental indicators, socio-economic indicators, health policy indicators, and indicators of quality of life. So that way we got a large number of indicators which are there, and the most commonly used are the morbidity and mortality indicators. When you start looking at mortality indicators, you have life expectancy is one of the more important one. Life expectancy Today, the life expectancy in India is said to be about 67. Then we have infant mortality rate, child mortality rate. So these rates are going down in India, but they're not going down as good as well as they should go down. Surprisingly, we are way behind Sri Lanka, and we are behind even places like Bangladesh. So maternal mortality rate, disease-specific mortality rate, and proportional mortality rate, these are various mortality indicators. Then the other morbidity indicators like incidence and prevalence, notification rates, OPD attendance rates, admission and discharge rates, and hospital stay duration and sickness absenteeism. So these are various morbidity indicators. Now the disability rates, even the disability rates are event type indicators, that is number of days of restricted activity, bed disability days, work loss days, and person type indicators like limitation of mobility or limitation of activity. Now these health indicators can be clubbed up to have you can create some sort of figure. So Sullivan's index is one such index where you have expectation of life free from disability. So if a person is disabled for lives for say 67 years, but is disabled for 5 years, then expectation of life free of disability becomes 62 years. 62 years he was free of any disability. Or you can do a health adjusted life expectancy at birth, adjusted for the time spent in poor health. That can be because you can't really remove those 5 years. That person is alive for 5 years. But yes, you have a problem of adjusting this. So there's a particular formula which you can use and come up with. The disability adjusted life years, which is that you adjust the life years with disability, measures burden of disease in the population, effectiveness of interventions. So with that, and there are various words which are used for indicators related to health services. One is availability of doctor population or various other populations which are there, or expenditure on healthcare, where you have how much percentage of budget is used for healthcare. In India, it ranges around 1.2%. And we're hoping that by about 2030, we'll be having 2.5%. This year, maybe we may have spent a little bit more because of COVID. So let's hope we have number of places, more facilities have come up, and hope that this continues. Health coverage, percentage of children fully immunized, deliveries, trained birth and birth attendance, percentage of cases with TB brought under ATT. So there are various health coverage indicators which we can think of. Other is the health services, accessibility of health services, utilization of health services, and the policy. So these all can be judged also. That's all that I have for you today. Very short lecture, but it is full of this thing. Please remember your prevention of diseases is a very important chapter. And second, your indicators. Please read up indicators and be ready for a question on the indicators. Comes very commonly in the exam. So please ensure that you read it up well. Thank you. Where are we?